Let's talk about health insurance for seniors. If you're a senior citizen, whether you're on Medicare or not, your health insurance is about to go up by a lot. And here's the thing, a lot of seniors are not even aware that this is about to happen soon, and they're unprepared for the percentage increase they're about to see in their health insurance coverage, including Medicare Part B premiums. So, this graph right here highlights everything that is happening. If you look by age, you're going to see that the coloring gets darker when you get to age 60 and above. Why is that? Well, it is part of the reason why the government is shut down, because health insurance premiums are about to go up by an insane amount in a lot of parts of the country, and a lot of seniors are not even prepared and may not even be able to afford the percentage increases that they are being asked to pay. And that is going to lead to a lot of catastrophic outcomes that a lot of people don't want. And that is why the government is shut down, because there's disagreement about these premium hikes that are about to take place if the subsidies are taken away. And this is not just private insurance. So if you are 65 and older and you think this does not affect me, you're wrong. I'm going to show you a graph that shows that Medicare is also about to experience price hikes that we've never seen in a very long time. So let's talk about it. My name is Kwame Kwade. I am a government benefits expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance issues that affect seniors and their retirement and their benefits. If you're new to my channel, welcome. I am glad you're here. Do me a quick favor, go into the comment section and let me know your city and your state. Now, if you've been watching my channel for a while, welcome back. I am glad you're here. We have a lot to cover today. And let me start by saying how we got here. So essentially, government subsidies that supported or help people to be able to afford health insurance are about to expire this year. And the government actually, Congress actually stripped it from people in the big beautiful bill. So when they passed the big beautiful bill, they put in provisions that took the subsidies away. These subsidies allow people to be able to afford health insurance, private insurance in the marketplace. So before I even do that, before I tell you how much people's premium is about to go out up if these subsidies are taken away, let me explain how the system works before we even dive deep into the data. So there are three different ways to get insurance right now, maybe four in the United States. One is employment-based insurance. So you work and your job has health insurance. And this does not matter whether you're, an older adult or you're just starting to work, it's the same. So you're either going to get health insurance through employment, that your job offers health insurance, or if your job does not offer health insurance, you are going to get private insurance from the private sector. It means that you are going to find an insurance carrier and they're going to quote you a price, usually through a broker. But now you have the marketplace. When the Affordable Care Act was passed, now they have a marketplace that you can go and shop for insurance if your job does not provide insurance. And so when you go to the marketplace, if your job is providing insurance, usually your job subsidizes your insurance, right? And so some work pay 100% of it, some make you pay part of it, but the job is subsidizing. So that's why employment insurance is so attractive, because most employers subsidize your insurance. And so you're not seeing the true cost of how much your insurance costs. That's why people like to get insurance through their work if they can. But most people, especially hourly wage workers, do not get insurance through their job. If you are working at a restaurant, most restaurants do not provide health insurance. And so you go to the marketplace and then you are hit with the sticker shock. the sticker price of how much truly it costs to buy insurance from the open market. Subsidies to help people afford insurance, meaning that based on your income, the government is going to give you, a certain amount of money to help you be able to afford insurance for yourself, right? Okay, so that is clear. Now, the if you are older, you're 65 and older, you get your insurance through Medicare, and then you pay a monthly premium through Medicare Part B premium to be able to cover. And then there are some other things you have to do if you want prescription drugs and other things, Part D. That's a whole separate thing. But Medicare is how 65 and older you get your health insurance. Now, if you've retired and you are not yet 65, you cannot get Medicare. And so you go into the private insurance market, or you're still working as a senior and you're getting it through your employer. So if you're a senior citizen and you are not yet qualified for Medicare, you are in this weird place where your insurance is expensive, very expensive because you're older. If you're not getting it through your work, then you have to get it through the Affordable Care Marketplace. Now, there's also Medicaid. Medicaid is health insurance for low income people. And so Medicaid also picks up some of that, where if you're low income and you cannot afford to buy insurance from the marketplace, if your income qualifies, then you get Medicaid. And so a lot of seniors who are low income are getting Social Security, but are not yet, qualified for Medicare, then are eligible for Medicaid. But there's a whole bunch of seniors who do not qualify for Medicare. They don't qualify for Medicaid. And so they have to buy insurance from the marketplace because their employer does not provide health insurance, or they've retired, but they need health care. So they have to buy insurance from the marketplace. Now, if you're buying insurance from the marketplace, the government gives you the subsidy based on your income to allow you to be able to afford to buy health insurance from the marketplace. So that's what has helped a lot of people to be able to afford health insurance. Now, this applies everywhere. So there is no, you know, it cuts across red and blue states. So it is not that, oh, blue states are getting it or red states are getting it. Everybody's getting it. The graph you see above, it shows average share of population using premium tax credits. So you can see it's all over the country, and you see the average credit that people are getting, to pay on a monthly basis to pay their health insurance. You can see 579, $527. Blue states, red states is the same thing. So this is not a political issue. This is an American issue. Everybody is facing the same thing. And I'm going to show you some polling that shows that people want this credit to remain, because majority of people realize that the tax credits are helping them afford health insurance. So this is a poll that came out from the Washington Post that talks, measured people opinions about the subsidy. 71% want the subsidies extended. Federal subsidies that reduce the cost of Affordable Care Act health insurance plans are scheduled to end at the end of the year. Should the subsidies be extended? 71% people say yes. Only 29 said no, that they must end. So a large, overwhelming majority of people, more than twice the number of people who said no, are saying yes. So people like the subsidies because it helps a lot. 500 and something dollars and a month to help you afford health insurance is a lot of money, and a lot of people find that helpful because $500 a month times 12 is 6,000. So it means that you would have had to, is that correct? I think so. 512 is, yeah, that's 6,000. So you would have had to pay $6,000 out of pocket to afford that health insurance. And so the government giving you that money to be able to afford health insurance, it's a great thing. And so I'm saying all of this to paint a picture of where we are and why we are in the situation we're in. Now, this graph shows you how many people have enrolled since 2017, when the tax credits have been given. So you can see enrollment with PTCs. you know, the tax credits, you can see that it forms a large number of people who are buying insurance from the private market and are using tax credit. And the tax credit have been increased since the pandemic to make it even more attractive and to help people afford health insurance. And so that shows you where we are. And so when the big beautiful bill passed, they eliminated the tax credit for a large number of people. And so the government shutdown is happening because, the Democrats are insisting that the tax credit should be put back because a lot of people are going to face a lot of pain. And when I'm talking pain, and that's what I'm saying, a lot of seniors are not ready for this. There's a lot of pain about to happen for a lot of people, and it's shocking how much. So I'm going to show you, I have all the receipts to show you the percentage increases that people are about to face when it comes to health insurance that nobody's prepared for. And a lot of politicians are pretending that people in this hyperinflation environment where people can barely afford anything, seniors can barely afford to live on their social security check. And remember, not every senior who is on social security gets Medicare, because you can start getting social security at age 62, and some earlier, depending on if you're getting spousal or survivor benefits earlier. So not everybody getting social security gets Medicare automatically. You have to be 65 and older. And so there are seniors who are getting social security but are not on Medicare, and they are getting insurance from the private market and with help from the government to afford it. So now let's look at the impact of what's about to happen. But before I do that, there's so much happening in the news, whether it's Social Security, Medicare, personal finance, both in and out of Congress. Sometimes it can be overwhelming. If you want to stay up to date on all of this, I want you to text the word insider to 443 293 0080 to join my text list. What that does is that when there's breaking news, I'm going to send you a text message explaining to you what the news is about, and most importantly, how does it affect you and your benefits and your retirement and your personal finances. So if that sounds good to you, text insider to 443 293 0080. I will only text you things that I know will be of value to you and help you stay current on things that will impact your benefits, your retirement, and your income, both in and out of Congress. So that is what you see on the screen. Now, let's go to the effects of what's about to happen, because I want to paint a picture for you. So let's start with this graph right here. So if you're a 60-year-old, okay, the national premium increases. We're talking about overall premium increase. All right. If you're 60-year-old, here's what's going to happen. If you make less than $30,000, right, and you're buying insurance from the marketplace, nothing's going to happen. But it means that if you're single, mostly if you're a couple, right? If you're a couple and you make less than $30,000, it means that you're getting the bare minimum, right? If you're getting Social Security, it means each of you are getting about $1,200 a month in Social Security. That's how you get to 30,000. Nothing changes. But just look, if you make 42,000, all of a sudden your premium is going to increase by 168%, because currently you are paying $924, and then now you're going to go to $2,474, an increase of $1,550. If you're making 62,000, your premium is going to go up by 42%. And check this out. If you're a senior couple making 82,000, and that's not a lot of money. That's not a lot of money. Like two people making 82,000, your healthcare premium is going to go up by 363%. Because you're going to go from $6,970, what you're paying now, to a whopping $25,000. Now, that may shock you, but that's what's about to happen if these subsidies are not increased, are not kept in place. So let's look at what's going to happen. I talked about seniors age 60 making 82,000. Well, look across the country of what's going to happen to that group. You can see the darker the color, the more you're going to see an increase. So in certain states, you can see that, Alabama, West Virginia, Wisconsin, Maine, Vermont, Montana, North Dakota, Oregon, California, New Mexico, all over the country, people are going to feel a lot of pain. And you can see that the dark spots, the really dark red that we see here, or whatever color we want to call it, it's 24,000 to 45,000 increase. That is how much your health insurance. It's ridiculous. This is crazy. And I have more graphs to show you that highlights the problem clearly. And so let's see here. Now let's look at rural. A lot of us. Well, I have one more to show you. So let's look at families. Okay, families will face high premium increases if tax credits. Now, if you're a senior citizen, well, you have family members that are, in their early 20s, early 30s, early 40s, early 50s. This is what they are also going to be looking at. So it doesn't just affect seniors, it affects the entire country. Everybody is going to be impacted. So if somebody is making, 65,000, a family is making 65,000, that is not a lot of money. But all of a sudden, your premium is going to go from $1,500 to $3,800. If you're making 95,000, you're going to go from 5 to 8,000. And if you're making 126,000, let's say a couple making $60,000 each, that is average. That's like two teachers, in an average American city or an average American town, making $60,000 each to 126,000. And then you have like $19,000 in healthcare premium without the subsidies. Okay. So that is where we are. So what does this all mean? This all means that Congress needs to act and do their job, because not keeping the premiums in place is irresponsible. Here is what's happening. The worst states that are going to be hit: West Virginia, 387% increase. Wyoming, 382. Alaska, 346. Texas, 289. Alabama, 284. North Dakota, 234%. I mean, these are insane numbers, guys. This is not good. And the fact that politicians are sitting there and going on camera with a straight face and pretending like somehow this is okay is not, it boggles my mind. So, and a record 93% of marketplace enrollees, or 19.3 million people, receive premium tax credits. These tax credits provide upfront financial assistance to help people afford the individual or family health insurance plans offered in their state through the Affordable Care Act marketplace. So 19.3 million people, and the average, they're getting about $700 on average per month to be able to afford health insurance. So what needs to happen? I think politicians just need to do their job, because without it, they're going to cause a lot of pain. Now, let's talk about Medicare when it comes to seniors, because a lot of seniors don't know that their Medicare Part B premiums, Part D premiums are all also about to go up. And I have the graph to show you what's happening with Medicare right here. So your Medicare Part B premium, 11.6%. Medicare Part B deductible, 12%. Medicare Part D base beneficiary premium, 6% increase. I mean, it's not as drastic, but it's still more than your cost of living adjustment is going to be, because COLA is forecasted to be 2.7% in 2026. So your Medicare premiums are going about four times the amount of Social Security increase that you're getting. So it is not just people who are not on Medicare, because Medicare is also seeing a big premium increase. Talking about Medicare, we are in open enrollment. And for me, this is a season that I have made a commitment that I'm going to help 100,000 seniors get peace of mind about Medicare. Why? Because you earned it and you should get the best out of it. 90% of all seniors are in the wrong Medicare plan. It's costing you money, it's costing you your health. And so my job is to educate you, like I'm doing today, about Medicare, and also create useful resources to help you understand better what your options are, and then connect you to the best resources. And the reason why 90% of seniors are in the wrong plan is because there are 24,000 Medicare plans out there. And it's so hard to sort through what is a good plan. And the plans are changing constantly. There's always something happening in the news regarding Medicare. People are being dropped by the numbers. Here's a headline: United Healthcare dropping 600,000 people from their plan. Hospitals are switching plans. And so it got so bad that the Trump administration had to sue a whole bunch of Medicare advisory companies for misleading seniors, trying to make profit by leading seniors into the wrong program. So my question to you is, can you trust your Medicare advisor? And that's why we're partnering with Chapter Medicare, because Chapter is not trying to sell you anything. They are there to help you understand the plans that you are eligible for in your local area, because a lot of these plans are location based, state specific, county specific. And so they have access to all 24,000 plans. They're actually the only advisory company with access to all of it. And so they can look and tell you if you are in the right plan for you. And if you're not, they'll help you switch. And so we've sent over 2,000 of our viewers like you to Chapter, and they've had the peace of mind that I'm talking about, because it's about knowing that you have the right plan that fits your budget, fits the coverage that you need, the hospital network, the doctor network, the prescription coverage that you need, that your plan is going to take care of you, and that all these changes that are happening is not going to impact. So even though it's open enrollment, you may feel like your plan is good, but you don't know the changes that have happened. And some of these changes don't even hit the news. And so you want to make sure that you get that peace of mind by calling Chapter, so that they can check your plan. And if you're in a good plan, they'll tell you. And if you're not, they're going to help you switch. So call 539-205-2147, or go to askchapter.org/insider, and you'll fill out a quick form. It takes about a minute. And then they'll reach out to you and help you sort through this Medicare that gets so confusing and overwhelming for a lot of people. These are their team members. I pulled it from their website, actual people you're going to be talking to. And here's the thing: they can save you a lot of money. On average, they've saved people $1,100 during the enrollment period. So we are in open enrollment. We're about to hit that next week. So give these guys a call and get ahead. They are A+ rated with the Better Business Bureau, tons of 5-star reviews. And for me, having done this for 15 years, I trust these guys, because these are the first Medicare advisory companies I'm working with, because they're not pushing anything. They're not trying to sell you anything to make the biggest commission. They're there to be in your corner and help you make an informed decision and switch to a better plan that is for you. So give them a call today. I'll put the link in the comments. I'll put the link in the description to this video. And if you like what you heard, hit the like button, hit the subscribe button, and I'll see you in another video tomorrow.